I'm joined today by Gabriella Day, who's a GP and homeopath based in Southampton. And I've been following you on LinkedIn for some time, and I saw a post a while ago that really interested me. And you'd posted about the fact that the health service is based around anxiety. So could you tell me a little bit more about that?
Yeah, absolutely. So lovely to be here. Thank you. So even before COVID, this was an issue. So you go through medical school, and obviously you learn a lot about your sort of basic conditions and how they present and how you deal with them. But once I entered into general practice, I quite quickly started to see that there were lots of things that you couldn't just go to your textbook and say, well, this is what it is, and this is how we manage this. And lots and lots of symptoms that don't really fit into a particular pattern, maybe, but also symptoms that, something like abdominal pain, for example. Somebody can have severe excruciating abdominal pain, and they might have pancreatitis or a bowel obstruction or something like that. But abdominal pain can be very normal. We can all, we all get intermittent pains in the tummy. And when do people present with these pains? So I remember learning years ago about people's threshold for coming to see the doctor. And that's a hugely variable thing. It seems to me that since the whole COVID phenomenon, the levels of anxiety have just escalated massively. I think there's lots of factors behind that. I think a key thing was that a lot of people in a situation that was promoting fear, so the media was all geared up to pushing out all this fear all the time about this illness. People were then abandoned to be by themselves and, discouraged from contacting healthcare. And also, if you do contact healthcare, or if you end up in hospital, you might die because this COVID virus is out there. So, I had a lot of patients that I saw sort of later on who hadn't presented because they hadn't gone to hospital because they were afraid that if they went into hospital, they were going to die of COVID. So all of these people, we know that fear and anxiety, is increased by isolation, not being able to communicate with your friends, your colleagues, your support network, who all sort of help boost you. And we're herd animals, aren't we? We like to have support together. We're not designed to isolation. And of course, so with that isolation and the escalating fear and anxiety, you get more and more anxiety about any particular symptom. There was another thing about the COVID time, which was that people were given rules, and the rules didn't necessarily make sense. And then the rules would change, and then the rules would change again. And it's like shifting sands onto people. People get to the point where they've got no idea what the sensible thing to do is. So then they're disempowered. So then they feel like they have no control. The only thing they can do is do as they're told. And then they start, and this isn't everybody, but a lot of people will then start to feel like they can't function without being advised as to whether this is okay or whether it's not okay. Now, of course, the doctors and health professionals went through the exact same thing. A lot of doctors would have been shielded a little bit because they were still at work. They still had contact with colleagues and they were facing these things. They would have been less anxious and afraid because they were working through it. But if you think about doctors in A&E and places like that, in hospitals, who were really traumatized by it. So the health professionals have been through this this whole experience as well. We've also got the situation where we're getting more and more sort of guidelines or diktats or about this is how you should do something. And with rising litigation, you've got doctors who are worried that if they step off the guidelines, then they're going to be in trouble. If they miss something, they're going to be in trouble. So we're ending up with patients attending with a much lower threshold to attend for a symptom. And then you've got a doctor who is also more anxious, but also concerned about being sued because it's a realistic possibility. And so investigations maybe get arranged, or escalations happen, somebody's sent to hospital with a much lower threshold. And again, so a patient who might have come in thinking a symptom was quite minor but just wanted some reassurance, then gets, then it's gone down the route of, oh, actually this could be cancer, or you could be having a heart attack, or all of this stuff, and it's all escalated, and and the fear rises and rises, and again it's promoting a distrust of one's own sort of instinct, which, let's face it, if they were left to it, most people could work out whether or not they needed an ambulance generally.
Yeah.
But now you've got people being told by 111, call an ambulance, and the patient saying, well, I don't think I really need an ambulance, but they said I do, so it must be really concerning. And so people completely lose trust of their own instincts.
Yeah, definitely. And I know from working in mental health, I've seen a big rise in health anxiety. And that's very, very difficult to treat, because once people are reassured about one thing, they'll then move on to worrying about something else.
Absolutely. Yeah. And so my book, actually, because I can bring it in here, called In Defense of the realm being the body, mind and soul. So we all have a body, mind and soul. And unfortunately, the kind of medical system is focused on dealing with the body bit, the material aspect of it, and kind of ignoring the emotional, spiritual elements of it. And of course, if you're in a system, there's a brilliant book by Dr. Nick Reed called Sick and Tired, and it talks about how through the last few hundred years, people have adapted their presentations of what in the past might have been called neurosis to meet whatever the medical professional are kind of interested in at the time. So at one point it might have been seizures, or sort of later on, a lot of cardiac anxiety, then cancer anxiety. So it kind of fits with what the medical profession is most kind of anxious about, tends to be what the patients present with that they're anxious about. So, they then get what they need. And of course, what they're expressing as a need, what they're saying that they're concerned about, isn't actually what the underlying problem is. The underlying problem is a lack of faith in themselves, a lack of belief in themselves, a feeling of uneasiness, a feeling that, the whole of society is dysfunctional, and we're all kind of wandering around like headless chickens, not quite knowing what to do with ourselves. And that's kind of what is presenting, rather than the individual symptom. We've also, so then if you have a patient who comes in, I mean, it's a classic thing. If somebody comes in and they say, oh, I've got this problem with this, and you think, oh, that might be an issue. And then they say, and I've got another problem with that. And then I've got another problem with that. And you can see that they're all entirely unrelated issues. You start to see, well, hang on, there's a picture here, because you've got lots of symptoms that overall, individually they might be something, but when you put them all together, I think this is more likely to be anxiety. But if we do what we are tending to do a little bit at the moment, is to say, oh, we're only dealing with one problem. So you go with, okay, we'll just go with that one problem. So we'll examine that, we'll investigate that, we'll manage that, and then we'll talk about the next problem next time. Now, if you'd actually looked at the whole picture and picked up, hang on, I think this patient, this is more likely to be anxiety. And actually, if we can get underneath all of these symptoms and work out what the underlying problems are, then we can actually move their life forward so that they're not actually coming back with all these different symptoms.
Yeah, because if you've got somebody who's coming back for one thing after another, and as you mentioned before, there's that all these guidelines and policies and worried about being sued, and rather than reassuring them, you're sending them off for tests, then that's just going to increase that health anxiety.
It's increasing it, and the thing is, it's a balance, because all of those tests cause more harm. You're causing more mental distress, more anxiety for the patient, because the doctor doesn't know what it is, and we're not sure, it could be something serious. So you're actually escalating their anxiety, and of course we need to do a certain amount to exclude something serious. But there comes a point where that over-investigation is causing a lot of harm. And if we could just stop and, pay attention to what the patient's actually really trying to tell us, which is about some deep, and I mean, I've spoken to doctors in the past who've said, you know, and then they started talking about this issue from the past, and I really didn't want to get into that. And the stupid thing is that if you get into that traumatic incident that happened all those years ago, or you get into the fact that during COVID they were absolutely terrified because they were told that they were highly vulnerable, you know, and they spent months and months in absolute outright terror. Once you get into that and you start dealing with that problem, for one, they'll trust you more. And if they trust you more and they feel able to bring these things out to you, then you can deal with things better. They're less likely to attend, because ultimately we want patients to be empowered, don't we? We don't actually want them to be dependent on us. We want them to be able to go and live their lives and enjoy their lives. I mean, what's the point in being here if all we're doing is spending all the time at the doctor's? And if we get to the point where everybody's like, oh, I've got a bit of back pain, or I've got a bit of anxiety, I've got a bit of this, I've got a bit of that, so I can't work because, you know, who knows what might happen. I mean, where are we going to be?
Yeah.
You know, we need to be thinking of actually, Paramahansa Yogananda, actually I think it was Sri Yukteswar who said, it is better to die thinking you are well than live thinking you are ill. Obviously, there's a significant issue going on. Yes, we want to address it, but if this anxiety is getting in the way of everybody actually functioning, it's really helpful.
Definitely. I know one of the biggest challenges I had with helping patients with health anxiety is that I'm not qualified to tell them that there's nothing wrong with them physically. So I'd then have to refer them to the GP, because if something happened, then I'd get sued, and there's certain red flags that if they mention, it's right, okay, I've got to refer this on. So things like chest pain, severe headaches, that kind of thing. So it is really difficult, and it's finding the right kind of professional to really help with that.
Absolutely. I think because actually what you don't want to do is just be saying to people, it's nothing to worry about, go away, without actually paying attention to what they're telling you. Because what you want to be doing is to start off with, if you're reasonably accessible, and it's a whole nother story to talk about accessibility in healthcare at the moment, but I do think that there would be capacity if we actually dealt with the real issue, mental issues. So if you're accessible enough that the anxious patient can come, and that you build trust that you will listen to them, you will pay attention, you will do what you think, and they come to realize that you are acting in their best interests, that you are paying them attention, that you are listening to them. And then they can start to, as they build the trust, they can disclose other stuff that might be underlying it. You can then affirm them, you can validate them, you can say, I can see why you're so anxious, I can see why you do. And if we can actually deal with the underlying problems, what you then are able to do is increase their own faith in themselves.
Yeah.
Ultimately, that's what needs to happen, is that people need to have more faith in themselves and their own ability to make decisions. And it's very difficult when people are being bombarded constantly by adverts and things telling them to be worrying about. Now, of course, you know, if you've got a barn door symptom, then don't ignore it. But being constantly bombarded by information about stealth illnesses that might come up and, you know, take you off in the night, it's it's really hard. And I mean, I don't have a TV license anymore, and I don't listen to the news because I think it just it's brainwashing, because basically the news is telling you what to think and telling you what to be worried about, telling you when you should be afraid.
Yeah.
You should be judging that on its own merits. You know, we can go outside, we can see what's going on, we can talk to other actual people, and make our own decisions about whether we need to be afraid or whether we need to be happy or sad or whatever the appropriate emotion is. We need to be rebuilding our faith in ourselves to make those decisions for ourselves. We're autonomous beings, and of course we should be listening to information from people who know a lot, but all of that information could be weighed up. to fit our own lives. So for example, if you go to see an expert and they say, you know, they give you some information, you don't just take that verbatim, you take what they say, you decide what you trust of what they say, then you personally decide how it's relevant to your life and whether you want to take it on board or not.
Yeah, definitely. And I think there is that, the problem with the health anxiety as well is if they go to see somebody regarding anxiety, and I'd be trying to talk to them about emotionally what's going on for them, and it instantly come back to, I've got these symptoms, I've got this, and it's very difficult to move past that.
Yeah.
And I think as much as Google's fantastic, if people start Googling the symptoms, it's great because people can find out more about what's going on with them medically. However, I've done this myself. It leads you to yourdoomed.com. So I think that plays a part as well. And one thing I've done with patients with health anxiety is basically said, no, you do not Google your symptoms.
Yeah, I mean, I think that's really sensible. Yeah, because I mean, there's always the worst case scenario, which obviously has to be provided in the information. You have to say all the eventualities. It's like when you go for an operation, isn't it? It's like risks of anaesthetic death. I mean, they have to tell you
Yeah.
that is a possibility. But I mean, we're not good at risk assessing, are we? That's the difficulty. I mean, we face risks every day, and we have to accept that it's not binary. It's not a case of this is safe. I mean, a lot of patients really struggle with that.
Yeah.
You know, it's not a case of either you're safe or or it's dangerous. There's grey in between. There's masses of grey in between. Yeah, that, I mean, grey areas is a massive thing. But doctors and patients, we all need to learn to deal with that uncertainty better. I'm just thinking, you know, there are patients who, yeah, it seems that no matter how you try and get in to try and get past these symptoms, they won't past it. And I think, you know, if they've built a wall that thick, it's going to take a lot of time to get through it. There aren't any, I mean, they say that with raising children, don't they? With behaviour, there's no quick fixes.
Yeah.
If a child plays up and you give them a severe punishment, that doesn't correct them, it just frightens them. All you're doing all the time is trying to teach them so that next time maybe it'll be a better outcome. And if somebody's built up because they've felt unsafe in childhood, not able to express their emotions, if they have expressed their emotions, they've been made to feel vulnerable or exploited for having expressed their emotions. So they've built up a big, massive, thick wall, and they trauma that's so profound that they feel that they're not strong enough. They feel that they will be totally overwhelmed if that stuff comes out. You can't break through that barrier quickly, so we have to sometimes just accept that they're not ready, and that can be frustrating. But again, the only thing you can do is just, you know, try and, it's back to that thing, what's the term, continuous positive regard. That you know, you keep that faith that when they're ready, if you've maintained a good relationship, they will come back, and when they're ready, you'll be able to help them. I don't think there's no quick fix to this. It's something that's going to take a long time. But you know, sometimes just being aware of an issue is helpful, isn't it? You know, you give a bit of a voice to that little voice in the back of your mind that says this presentation doesn't make sense. What they're telling me, you know, as they're adding more and more information, this doesn't make sense with any clear medical diagnosis, and there's something else going on. If you just have that awareness, and then you wait for the opportunity to arise, and it has to be done sensitively. But I do think, you know, there are patients who are just waiting to be given that opportunity. So, yeah, the more we can just, you know, be prepared to take those opportunities. I mean, I've had consultations sometimes where you see that somebody's coming in and what they're coming in with, and you get a sort of heart sink about the fact that they're coming in, and then somehow an opportunity comes up to dig in further and unearth things, and then either they've been aware of it but haven't been able to share it somehow, or you know, or some realization occurs, and it can happen really unexpectedly. So I mean, it's hard if you've been in clinic all day and, you know, everybody's coming in and they all want antibiotics, and, you know, it's hard to maintain that openness. But whenever we can, that moment could arise any time. And if we can be supportive for the patient, that's something that I think GPs really need to be able to do, is that often doctors think that if somebody discloses some major trauma, they need to be able to fix it. And of course, you don't. We just need to be human beings, don't we? We just need to be able to listen to it, to validate it. You know, we can just say, oh my goodness, you've been through such a lot, you know, just to say, to reassure them that they've been heard. And then we can ask somebody for help, or we can refer them on to somebody else. We don't have to deal with it all ourselves.
Yeah.
Opening up that box and allowing the patient to feel supported in that space could be the absolute turning point for that person.
Yeah, and I think that's why it's really important that the ridiculously short GP appointment times get challenged, because if you've not got that time to talk to people about things, I mean, I don't know any doctors that would boot anybody out of the room if they did open up about anything, but there's that kind of time pressure that's a bit of a barrier with this as well.
Yeah, absolutely, because the patient perceives the fact that you're rushed, and you know, they're not going to have time to deal with it. So you know, they might have come in thinking they might open up about something, but clearly you're rushed and stressed, and they're not going to. So, yeah, I mean, it's a multifactorial problem. But you know, it's not helped by the more productivity is better attitude. You know, the more patients the doctor sees, the more problems the doctor is dealing with every day, the better job they're doing. Well, no, that's not the case, because if you've got the same person coming back 50 times a year and they're no better, that's not actually productive. That's just a waste of everybody's time. So yeah, I often think it would be good if we could separate out groups of patients into, you know, I'm worried that I might need to be in A&E, or I've got an acute problem that needs to be dealt with, and you can say, okay, well, we'll quickly deal with that and make a decision about that. But then if it needs more time, then have other appointments that are longer to say, well, yeah, I think you need to be able to come back. I mean, I absolutely believe that all these problems are solvable. But I think that we need to be dealing with things slightly differently. I mean, my perception at the moment is that we're addressing the material aspect, we're addressing the physical body aspect, and we're dealing with that very efficiently, very effectively, and yet people are not getting better. People, in general, the population doesn't seem to be more fit and healthy and well and happy and joyful. And it's because we're ignoring these spiritual aspects. The spiritual aspects. So it's like if you've got somebody who's really thirsty and you just keep giving them food, you can give them as much food as you like, but they're still really thirsty, and you haven't actually done anything helpful. So this apparent avalanche of need, this overwhelming need, is not going to be addressed as long as we only concentrate on the physical. We need to accept that the physical and the emotional, spiritual aspects are intricately intertwined. They can't be separated.
Yeah.
And when we can do that, then we can start to address, you know, that massive demand that we're not getting through at the moment.
Yeah, absolutely. Seeing the person as a whole person, not just a set of symptoms.
Yeah. Yeah, I mean, that's how we all want to be seen, isn't it? Another thing I've been thinking about recently is just being honest. You know, because if people feel they have to lie to get through the door, they're going to lie. And if they lie, you can't get the full story, and then you can't actually deal with the problem. So we need to be as honest as we possibly can. And if we're sort of thinking about risk, if we can be honest in our conversation about risk with the patient and share that risk with them, a lot of patients will be capable of understanding that element of risk and sharing that decision making about, you know, how much risk people are willing to carry. And if we can be honest ourselves when we don't know the answers. But, you know, we can often say, look, I can't tell you exactly what it is. I can't give you a definitive answer, but I think it's highly unlikely that it's going to be any of these serious things. If we can be honest about that, then the patients perceive our honesty, and then the patients are more likely to be honest back.
Yeah, and as well with that, because some patients do have this opinion that doctors dismiss what they're feeling and fob them off and things like that. Whereas if you've got that honest dialogue, you're actually showing that you're listening and that they're being heard, and you're, as you said, validating what they're experiencing.
Yeah, and when it comes to resources in the NHS, because there are loads of people who could do with all sorts of resources, particularly with psychological help, and they're just not available. If we can about the fact that there just isn't the capacity, so that the patient realizes that it's not just your I think sometimes people think you're hiding a solution from them. I often get this impression is that the patient comes in and I say, well, I don't think you need that, and I don't think you need that, we could do this or this, and they don't want any of those, and it's like they're waiting for you to, it's like you're hiding something from me. There's another perfect solution somewhere that you're refusing to let me access. So yeah, the more honest we can be about the limitations to the service as well, the better.
Yeah, definitely. Okay, so I know that you mentioned earlier about your book. So if you just remind us, what was the title of the book again?
So the book's called In Defense of the Realm, and the realm is your body, mind, and soul. And it's about reclaiming your sovereignty. And it started off, the whole idea of the book started off actually from patients who would come in often, extremely stressed, but they were often sort of very capable people who were doing an awful lot. And you might end up sending them for stress management or this, that, and the other. And, it kind of occurred to me, this isn't appropriate. You might be giving them antidepressants as well. So you're giving a patient antidepressants, sending them for stress management. And the actual problem is that the situation they're in is abusive, or they're being abused by their work, they're being abused by a partner, somebody is exploiting them, or so and I just, it's like medicating for somebody to be able to put up with a dysfunctional situation that's not their fault is just not appropriate. And so it's kind of that taking back control of your realm, and that might be your mind space, because often we've been heavily taught, heavily indoctrinated that it's good to suffer and that we should work hard, and if we're not succeeding, or if everything's not okay, it's because we're not working hard enough and we're not putting enough effort in. And it's actually rubbish. So we need to get rid of, what I'm trying to say is get rid of those voices in our minds that tell us good enough, that tell us that we need to work harder in order to achieve happiness. So re-exerting control over our realm, including body, mind, and soul.
Yeah. That sounds really interesting, and it sounds, a lot of what you just said there sounds like a lot of work that I do with healthcare professionals.
I really think so. I mean, the book's not written for for medical professionals, and it arose largely through dealing with my patients and trying to address problems. But over the last few years, I've increasingly seen how relevant it is to medical professionals, because if you're a high achiever, if you have high expectations of yourself, if you're somebody who likes to help other people, you're in the prime position to be exploited by other people, your patients, your boss, everybody. And basically these people take over your realm, and you end up being, basically it's like, it's like, I mean, I talk about Theoden in Lord of the Rings, when his mind's taken over by Saruman. You end up with your kingdom is basically being used to fight somebody else's battles, and your is left going, hey, who's looking after me? And if you don't look after your own body, if you don't look after your own realm, it will either stop working, or it will mutiny. It will turn against you. And this is the real how intricately the mind, the mind, body, and soul are interconnected. If you don't look at it, if you don't defend your realm, it will stop working for you.
Yeah. So if somebody wants to get a copy of your book, where do they go?
So it's not available yet, but I've got a website, gabrielladay.com, which has got some extracts from it, and I'll be putting stuff up. I'm hoping it's going to be out later this month, but it may be a bit later because I'm just waiting for final permissions on it. But it's not a poor me book. It's not about victimhood. It's very much about taking back control and empowering yourself. So I feel it's a really positive book. Probably not easy reading because some of the concepts in there are challenging, but it is really positive because ultimately, you know, if we can take responsibility for ourselves and look out for ourselves and look after ourselves and love ourselves, we can, you know, we can change things for the better.
Brilliant. I'll definitely be getting a copy when it's published. It's been great to have you here today on the show, Gabriella. So for our listeners, I hope you found this really interesting. I know I definitely have. And I will see everybody next week.
Thank you. Take care. Bye-bye.